Hello, everyone. Welcome back to this month's Body Signals workshop. This week, I'm going to be covering corrective spinal rehabilitation. My name's Dr. Chris. You guys can finally put a face to the name. I've been working at Provolution Health since September last year. So this month, we're going to be talking about corrective spinal rehabilitation. So how your spinal health is being influenced by the structure of your spine and how that's influencing your nervous system and how well we're functioning. Okay. So I'm just going to pull this up now. So we're going to click share the screen. All right. So everyone can see this here. All right. Start from the beginning. Okay. So corrective spinal rehabilitation. So to begin with, what is corrective spinal rehabilitation? Okay. So the topics we'll be discussing is, again, what is corrective spinal rehabilitation? What components does CSR involve? What cases does CSR work with? What does the research say about CSR? And what's the connection between chiropractic and CSR? Okay. So what is corrective spinal rehabilitation? Well, corrective spinal rehabilitation involves the assessment of the natural curves of the spine and adjust how stress is distributed throughout it. Okay. So as we know, many people live with spinal issues with constant pain and see the conditions worsen over time. So CSR focuses on shifting the load from harmful compressive load to more balanced tension, helping it stop spinal degeneration and reduce pressure on the central nervous system, leading to a higher elevation of quality of life and human potential. So corrective spinal rehabilitation involves improving the primary and secondary curves of the spine and alignment in order to evenly distribute the load through the discs, joints, muscles, ligaments, and tendons. So the primary and secondary curves of the spine. So the primary curves are made up of the thoracic spine, so this mid portion here, and the sacrum. Okay, so the primary curves are the natural curves present at birth, namely the thoracic upper back and the sacrum lower back curves. They are called the primary because they are the first curves to develop in a growing human body. Now the secondary curves, these are the ones that develop as the spine matures and the body begins to assume an upright position. So these include the cervical curve as well as the lumbar curve as well. Okay. These curves include, again, the cervical and lumbar curves. So the cervical curve forms when an infant begins to lifting their head up, developing the neck muscles and creating a gentle inwards curve, or known as a lordosis. The lumbar curve starts to form when the child can sit, stand, and walk. This results in a second inwards curve, or lordosis, in the lower back as the child weight bearing increases. So as the child starts to stand and develop, that lumbar curve starts to develop. As the baby lifts their head up and starts looking around at the world, it develops that neck curve. We can see that from the side there. Okay. So what is the significance of these curves? So I highlighted that we have primary and secondary curves, but what is the significance of these curves, essentially? So these curves are known as the arc of life. Okay, so arc of life is essential for the this disposal of forces and structural integrity of the body. It is the strongest form of engineering due to the importance it places in weight bearing distribution. Okay, so what does this mean for your health? So we can see here that the arc of life in your neck is this nice lordosis or neck curve here. Okay, we can see here we're losing that arc of life. And we're seeing flattening of the cervical spine or the neck curve. Okay, so this is going to change the distribution of load because the spine's supposed to act like a spring. So the forces can be distributed at the front and the back of the spine equally, just like with this normal neck curve here. So when we lose that curve, We're going to have compressive load going through the discs. We're going to have your body try to absorb and adapt to that stress by increasing tension on the ligaments, the muscles, again, the discs. And also, as the body has to hold this for a longer period of time, the body adapts to this by laying down more bone. So it accelerates the degenerative and arthritic processes that occur within the spine because of the structural change that occurs. So we can see here in the mid-back, okay, we want to have a nice reverse C-shaped curve through the mid-back there. Okay, that's the normal spine. And we can see here with this increased curve through the thoracic spine, this is known as hyperkyphosis. So it just means that there's a large increase in that mid-back curve, okay, as opposed to having a nice normal kyphosis through that mid-back there. So obviously this is going to place a lot more tension on the discs as they're being flexed, as the body is being flexed forward. So the disc has to move forwards as well, which places increased stress on the body. And we can see here in the lower back, that normal lumbar lordosis. So that nice reverse C, or that C-shaped curve that we want to see in the lower back here. Okay. You can see that there's changes that can occur with changes in your spinal health and alignment. So we can see that you can have an excessive lumbar lordosis. Okay, so we've got that increase in that curve. We can see that you can get a hypolordosis. So we get that flattening of that curve. Again, this is going to change the distribution of force that's being applied through the structures of your spine, which is going to have a detrimental effect to, again, degenerative and arthritic processes, as well as to the quality of the discs and the tension that's going to be placed on the muscles, ligaments, and everything that's surrounding and supporting the spine as well. And we can also see here that there's a reversal that can occur with these curves as well. Again, this is going to have a similar effect to the hypolordosis, where we're seeing the flattening, but it's just worsening because it's starting to reverse in the opposite direction. Okay. So these are all examples of abnormalities which impact your quality of life and expression of health. What does this mean? There is an increased susceptibility to injury. So there's an increased likelihood of accidents, falls, bumps, and spills. Early acceleration of arthritic and degenerative changes, just like what I've touched on. So what does this mean for your health? So the significance is chiropractic vertebral subluxations predispose spinal distortions. So the addition of spinal distortions establishes chronic patterns of vertebral subluxations, creating a cycle of degeneration, decline, and injury. So the purpose of chiropractic is to analyze, detect, and correct these subluxations to restore spinal curves and spinal integrity, and therefore the self-healing, self-regulating, and self-correcting elements in the body. Okay. What elements are involved in CSR? So there are various components involved in the correction of the primary and secondary spinal curves. These include primarily corrective chiropractic adjustments. Okay, then we have spinal hygiene, dental, exercises, neuroadaptive retraining, posture and ergonomics, comparison of measurements between old versus new, postural analysis, X-ray analysis, range of motion and mobility assessment, and adaptability assessment as well, which has to do with your heart rate variability assessment. Okay, there's been a link between chiropractic and increasing your heart rate variability. Okay, which is really good because it means that we're bringing people out of a sympathetic state and putting them into more of a rest and relaxation state. So less inflammation and more resting and healing of the body. So essential to the corrective spinal rehabilitation are chiropractic adjustments. So you cannot correct the subluxation with spinal hygiene. You cannot correct the subluxation with a dental roll. You cannot correct the subluxation with exercises. You can correct a vertebral subluxation with a chiropractic adjustment. Therefore, this is integral and essential to the CSR program and restoration of spinal integrity. Primary curves of the spine, and therefore even everything to that is adjunctive. So what cases does CSR work with? Okay, so CSR works with postural abnormalities, scoliosis, arthritis, headaches, migraines, back pain, disc issues, hyperkyphosis, kyphosis, FHC, so forward head carriage, teenage postural issues, stress, back soreness, sciatica, elite sporting performance, anxiety, and depression. So what does the research say about CSR? So the CSR research states that you're 16 times more likely to experience neck pain when you lose the normal curve in your neck. Okay, so we can see here a bit of an image outlining what actually happens when you develop forward head carriage. Okay, and the changes in the biomechanical load of muscles, primarily through the neck there, compared to a normal loading pattern with a normal neck curve. So there is a strong correlation between the development of degenerative disc disease in the lower back and a loss of lumbar lordosis when comparing symptomatic and asymptomatic populations. So what this means is that when we have change in the curve in the lumbar spine, or we see flattening of the lumbar spine, there is an increased risk and chance of development of degenerative disc disease. So changes in degeneration and arthritis through the lower back. Okay, when compared to people who experience lower back pain versus people who don't experience lower back pain. The symptomatic population, people who have lower back pain, are more likely to have a loss of lumbar lordosis. Okay, so here you can see that with the discs, what's actually happens when they get loaded. Okay, so we get that compressive load coming downwards. Okay, disc pushes out the liquid on the inside, which is known as the nucleus pulposus. Okay, and then you got the angular fibrosis on the outside, which is the fibrous component of the disc. Okay, and you can see that dispersal of force from the nucleus pulposus outwards. Okay, as a result of the compressive load that discs have to hold up. So the third point of research is the loss of your neck curve places stress on the spinal and nerve roots all the way down to the quadricorna and lumbosacral nerves. So an image here shows that with a normal cervical neck curve, there's normal tension being placed on the corner equina down in the lower back. Okay. Now, if we look at the flattening of the cervical neck curve, you can see here that there's increased tension that's actually being placed on the spinal nerves all the way down to the lower back. So they've put a latch on the actual fibers in the lower back, and they've had people with a normal cervical curve versus a flattened cervical curve. And with the flattened cervical curve, you can see that there's increased tension that's actually placed on the spinal nerves in the lower back. So we can see here that what's happening in the cervical spine can be affecting what's happening in the lumbar spine or the lower back. Okay, so the presence of loss of spinal curves increases the rate of arthritic or degenerative change in the spine. Okay, so like we've stated, changes in the spinal curves are going to influence your spinal health, the way you function, how you feel, and your overall quality of life, and I guess the what and how you're healing as well. So CSR and the brain. Okay, so the connection between CSR and chiropractic. So chiropractic involves the detection, analysis, and correction of vertebral subluxations within the nervous system. So over time, the body develops ingrained patterns that can negatively impact posture and the function. Okay, to achieve lasting structural changes in the spine, chiropractic adjustments must be combined with corrective spinal rehabilitation. This approach not only reshapes spinal structures, but also enhances function, ultimately improving health and the body's capacity for life expression. So we can see here in this case study here, this was done by a research group called Chiropractic Biophysics, which did a bunch of research into spinal curves and how redistributing the force and spinal rehabilitation helps with people via x-rays and via how they're feeling as well through different measures. So we can see here in this study here, we've got a before, after, and post-treatment in terms of how they examine the change in the neck curve. So we can see pre-treatment, there's flattening of that neck curve there. And see post-treatment with what they were doing. We can see that improvement in that curve there. And then follow-up, we can see that curve has improved significantly since the beginning, which is 6 months following chiropractic care and rehabilitation for that neck curve. So now that I know all this, what should I do next? Okay, so to truly address how your spinal health is impacting your function, a professionally trained chiropractor takes a holistic look at your spine, performing a thorough history and physical examination. Using advanced techniques, they can identify specific areas that may be holding you back from feeling your best, and they use X-ray imaging to get a detailed view of your spinal health. So health is not about how you feel, your body can heal. Call the practice, book an appointment, and transform your life. So to make an appointment, give us a call at 6299-2660 or email us at info@provolutionhealth.com.au. All right. And follow us on social media. So we have a Facebook account. So join us on Facebook at Provolution Health for regular updates on upcoming workshops, educational content, and our community as well. And you can also head over to our YouTube channel, Provolution Health, where we post all of our education videos onto. Okay. And that's all. So I'm going to stop sharing now. All right. So before we finish up, do we have any questions in regards to anything that was talked about today? Okay, we don't have any questions then. All good. Then we'll just be finishing up now. So it was lovely for you guys to hear this information. And I hope you all will have a great day or night. Thank you for listening.